All right, we're going to do a little bit of blood pressure background here. We're actually going to do it in 2 or 3 parts, okay? So first of all, there are a couple things that we can do to alter your blood pressure, okay? We can shunt blood to the core. When you shunt something, it is directing fluid away from something or towards something. So in this case, we're shunting blood to the core, and that means we're shunting blood away from the skin. How do we do that? We vasoconstrict the blood vessels in your skin. We turn them from a normal size to a smaller size, okay? And how do we do that? Well, we've got alpha-1 receptors that are located in the smooth muscle that surround your peripheral blood vessels, okay? So they're circular muscles that surround your blood vessels, and they contain alpha-1 receptors, and when we target those, you're causing the smooth muscle that surrounds your blood vessels to constrict, to contract, and the size of your blood vessels would then tighten up, okay? And that will cause a white guy like me to look pale, okay? Now, alternatively, we can do the opposite. We can also shunt blood to your skin, which is shunting blood away from your core. How do we do that? Well, the opposite of vasoconstriction is vasodilation. You're turning your blood vessels that go to and from your skin, going from a regular size to a very, very large size. And how do we do that? Well, we block alpha-1 receptors in the smooth muscle surrounding your peripheral blood vessels. So what that does is that allows these guys, the smooth muscle, to relax. And when you relax, a white guy like me is going to look flushed or pale. When you relax the blood vessels and you dilate them, you allow them to dilate going to the skin, okay? Additionally, we've got receptors in the heart. They're called beta-1 receptors. An easy way to remember it is you've got beta-1 receptors in your heart because you've got one heart. Beta-2 receptors are located in your lungs because you have 2 lungs, okay? When you target and turn on beta-1 receptors in your heart, they jack up your heart rate, and when you block beta-1 receptors in your heart, you lower the heart rate, and that's why some patients are on medications called beta blockers,